As promised, we are going to do a video on puberty in boys, as we've already covered puberty in girls. Puberty in boys starts around the same age, although the average age is 11 and a half, with the range being anywhere from 9 to 14 years old, so just a tad older than girls. For boys, stage 2, which is considered the first physical changes in a boy's body, is considered a change in the testicle size. So that's the first thing we see in boys. As we move to stage 3, we start to see an increase in penile length, and we also start to see the adrenarche, or the change in body odor, acne, and hair. So hair under the arms and hair in the pubic area, not facial hair. Facial hair is one of the last things we see. So those hair in the same places where we see hair in women. And the hair at first is not going to be mature pubic hair. It's going to be short and more fine. And as we get further through puberty, it will become more coarse and curly. So in the stage 3 is when boys' penises will start to grow. So make sure you're very comfortable telling your boys this, because it is a sense of embarrassment for them. If they're in a locker room or a gym, or they're in sports and they're seeing other boys, make sure you're pointing out differences, that there are circumcised boys and uncircumcised boys, so that they're not embarrassed by that. That bumps on the end of the penis are normal, that doesn't mean anything, and that the size of a penis is different, obviously, when it is flaccid versus when it is erect. Fertility starts 1 year after puberty starts, meaning when the testes start to grow. So boys start to produce sperm a year after their testes start to grow. And so that is when they could get a girl pregnant. And it's very important to know that. Obviously, we are hoping our boys are not doing anything that would, end up in that situation, but it's important we're communicating those things to our boys. During this time, it is very, very normal for erections to happen that they have no control over. And this is a common thing. And unfortunately, there's not a lot of things that they can do about it, but you need to make sure you're talking to your boys about that, show them how to maybe cover it up if it's happening at school, etc. It's also normal to have nocturnal emissions, also known as wet dreams. Explain to them what that is. They're not urinating in their bed. You want to make sure they understand what's happening to their body, okay? The fourth thing in the stage of body changes is the one that they're really excited about, which is their peak height velocity. So they go from just gaining about 2 inches a year to growing 4 inches a year, which is, when they start to catch up and surpass the girls. So in the beginning of puberty, the girls have already hit their peak height velocity because it's second in their development of puberty. For boys, it's in their 4th. So they're finally catching up and surpassing the girls in their stage 4 of puberty, and continuing to grow after that. Also happening in stage 4 is further development of their pubic hairs, growing longer, growing out towards their thighs, their penises growing longer as well, their testes are growing larger. It isn't until stage 5 that we really see facial hair occur. Stage 4, we are seeing some voice changes, and that will continue till the end of puberty. So voice cracking is very normal, and reassure your boys, every boy goes through this. The one thing I want to really, really point out is that about 50% of boys get a hard node under their breast nipple, okay? This is called gynecomastia. It is very, very normal. It occurs around 13 years old, and it can last anywhere from a half a year to a year and a half, okay? This does not mean they're going to go ahead and develop full breasts. It does not mean that they have extra estrogen. It does not mean that they are female. This is normal. If they push on it, if they, keep pressing on it, it will hurt more. It's already going to be a little bit sore. It can happen in one side or both sides, okay? But gynecomastia is a very normal, very common thing to happen in boys during puberty. Again, around 13 years. So if the average age of the onset of puberty is 11, we're talking about 2 years in. So if this happens to your son, let him know it's normal. It's very distressing. And oftentimes boys don't want to take their shirts off in PE or in sports, etc., or in the summertime. But again, 1 in 2 boys this happens to. So very, very common. Puberty in boys ends around 16 to 17 years old. That does not mean their growth ends at this time. They grow into their 20s. So just make sure that you are letting them know that they are going to continue to grow. Obviously, we're still maturing in our prefrontal cortex. That's where, we're making mature decisions and our emotions, etc. So while our puberty has ended, our maturity is still coming, etc. Muscle mass is developing through there. So our body composition is changing throughout puberty. And we're going from having sort of a preteen body that is maybe more lean or has a little bit of baby fat, if you will, to having more muscle mass and ability to strength train that body into having more muscle mass that's defined. This is when I feel more comfortable letting kids use weights and not just body weight for strength training for sports, okay? But it's incredibly important to talk to your boys about things that might embarrass them, reassure them about their penises. This is such a common thing. Boys are often embarrassed and don't want to talk about it, but inside they're comparing, okay? And talk about sex. Talk about how to be protected when this decision comes about, what it is, all of the nuances about it, oral sex, vaginal sex, everything, okay? I know that you're maybe not ready for that, and you can take this in pieces. You can do, the first part of this, just puberty, and then as they get older, do the second part of this, okay? But at some point, you need to tackle all of the aspects of this, okay? But definitely tackle the embarrassing stuff. Don't be scared to do it. I have 4 boys. I don't have any daughters. I didn't grow up around boys as far as in my house, so I've had to tackle this in my own house, and I want everyone to feel comfortable knowing what they're talking about. Healthychildren.org has tons of information, so it can make you a little bit more comfortable as you sit down and talk to your children.